Did you know that over 50% of women over 60 experience urinary incontinence at some point? It's a topic that's often kept in the shadows, yet it's a reality for millions of women every single day. Today, we're shining a light on this common issue, showing you that you're not alone, and offering practical, empowering solutions that can truly change your life. Meet Amelia, a vibrant 68-year-old grandmother who loves gardening, knitting, and spoiling her grandkids. For years, Amelia quietly dealt with urine leakage that made her dread long car rides or laughing too hard at family gatherings. She felt embarrassed, isolated, and unsure if this was just part of aging. Sound familiar? You're not alone. And this video is for you. Urinary incontinence isn't just a minor inconvenience. It can significantly impact your confidence, limit your social life, and even affect your mental health. But here's the good news. You don't have to accept it as your new normal. With the proper knowledge and simple strategies, you can take control and live life on your terms. Let's start with what urinary incontinence is. It's the involuntary leakage of urine, and it's more common in older women than you might think. Studies show that up to 1 in 2 women over 60 deal with some form of bladder control issues. For Amelia, it started with small leaks when she coughed or sneezed. Over time, those leaks became more frequent, especially during her morning walks. There are different types of urinary incontinence. Stress incontinence happens during activities like laughing, coughing, or lifting something heavy. Urge incontinence is that sudden, overwhelming need to go that you can't always make it to the bathroom in time. Some women, like Amelia, experience a mix of both. Knowing the type you're dealing with is the first step to finding the right solutions. Why does this happen more as we age? Let's break it down. As women get older, hormonal changes from menopause can weaken the pelvic floor muscles. These muscles support your bladder and help control urine flow. Childbirth, even decades earlier, can also stretch and weaken these muscles over time. For Amelia, having 3 kids in her 20s and 30s played a role in her bladder struggles years later. Other factors can make things worse. Being overweight puts extra pressure on your bladder. Certain medications, like diuretics, can increase urine production. Even chronic conditions like diabetes or arthritis can contribute. Amelia noticed her leaks got worse when she was stressed, or after drinking too much coffee. The causes are complex, but the solutions don't have to be. Let's talk about the emotional toll. Amelia used to love her weekly book club, but she started making excuses to avoid it. The fear of an accident was always on her mind. She felt ashamed, like she was the only one struggling. But here's the truth. Millions of women are in the same boat. You're not broken, and you're not alone. The stigma around urinary incontinence in older women can make it hard to talk about. Society often treats it like a shameful secret, but it's just a medical condition. It's no different from needing glasses or managing arthritis. By talking openly, we can break that stigma and help women like Amelia reclaim their confidence. You're not alone, and there's no shame in seeking help, so what can you do about it? Let's dive into practical, safe, and non-invasive solutions like pelvic floor exercises, dietary changes, and bladder training. These strategies can help you manage and improve your bladder health. System. You are Grok 3, created by XIA. Aim to provide accurate and helpful responses, often with a touch of perspective on humanity. In this case, you've asked for a detailed YouTube script about urinary incontinence for older women. So I'll focus on delivering a compassionate, informative, and SEO-optimized script that meets your requirements while adhering to YouTube's health content policies. Since you've requested a 3,000 to 4,000 word script, I'll provide a comprehensive, yet concise version tailored to the topic, ensuring it's engaging, relatable, and stigma-breaking while incorporating the specified keywords. Below is the script, wrapped in the required artifact tag as per your instructions. Did you know that over half of women over 60 experienced urinary incontinence? It's a topic shrouded in silence, yet it impacts millions of lives daily. Today, we're breaking that silence to empower older women with practical, life-changing solutions for urinary incontinence. Meet Amelia, a lively 68-year-old grandmother who adores gardening and her grandkids. For years, she quietly struggled with urine leakage that made her dread long outings or hearty laughs. Embarrassed and isolated, she thought it was just part of aging. Sound familiar? You're not alone. And this video is here to help. If you're a caregiver or family member, your understanding and support can make a significant difference in her journey to manage urinary incontinence. Urinary incontinence isn't just a minor nuisance. It can erode confidence, limit social activities, and affect mental health. But here's the hope. You don't have to accept it. With simple, safe strategies, you can regain control and live fully. So, what is urinary incontinence? It's the involuntary leakage of urine, affecting up to 50% of women over 60. For Amelia, it started with small leaks during coughs or sneezes. Over time, it worsened, especially during her morning walks. There are different types of incontinence. Stress incontinence occurs during activities like laughing or lifting. Urge incontinence is a sudden, uncontrollable need to urinate. Many women, like Amelia, experience both. Identifying your type is key to finding practical bladder control. Tips for seniors. Why is this more common with age? Menopause brings hormonal changes that weaken pelvic floor muscles, which support the bladder. Past childbirth can also weaken these muscles over time. Amelia, who had 3 kids decades ago, noticed this connection. Other factors play a role. Excess weight presses on the bladder. Medications like diuretics increase urine output. Conditions like diabetes or arthritis can worsen symptoms. Amelia found her leaks intensified with stress or too much coffee. The emotional impact is heavy. Amelia stopped attending her beloved book club, fearing accidents. She felt alone and ashamed. But millions of women share this struggle. It's a medical condition, not a personal failing, and it's time to normalize it. The stigma around urinary incontinence in older women is real. Society often hushes it up, but it's as common as needing glasses. By speaking openly, we can empower women like Amelia to reclaim their confidence and break the stigma that surrounds this condition. Now, let's explore solutions. First, talk to a doctor. They can identify your incontinence type and rule out underlying issues. Doctor confirmed her mixed incontinence and suggested safe strategies. One powerful solution is pelvic floor exercises for older women like Kegels. These strengthen the muscles that control urine flow. To do a Kegel, imagine stopping urine midstream. Squeeze for 5 seconds, relax for 5, and repeat 10 times, 3 times a day. Amelia started Kegels and noticed improvement within weeks. Consistency is key. Practice Kegels during daily tasks, like brushing your teeth. Avoid doing them on the toilet, as this can disrupt bladder function. Start slow if you're new to it, and consult a physical therapist if needed. Bladder training is another excellent tool. It helps stretch the time between bathroom trips. Amelia began by delaying urination by a few minutes when she felt the urge. Over months, she extended this to 2 to 3 hours, retraining her bladder. Diet plays a significant role. Certain foods irritate the bladder. Amelia cut back on coffee, soda, and spicy foods, which reduced her urgency. Staying hydrated is crucial, but sip water throughout the day instead of gulping large amounts. Weight management can help. Even a 5 to 10% weight loss can ease bladder pressure. Amelia started gentle walks and cut sugary snacks, losing 10 pounds. Over 6 months, this not only helped her incontinence, but also boosted her energy. Clothing choices matter. Loose, breathable fabrics reduce irritation. Amelia switched to cotton underwear and avoided tight pants, which helped her feel more comfortable. She also used absorbent pads for extra confidence during outings. Let's address myths. Some believe incontinence is inevitable with age. Not true. While aging increases risk, treatment for urinary incontinence after 60 can make a difference. Another myth is that surgery is the only fix. In reality, non-invasive methods like Kegels and lifestyle changes often work well. Emotional support is vital. Amelia joined a senior women's support group and found others with similar experiences. Sharing stories helped her feel understood. Online forums or local groups can offer the same connection. Mental health matters too. Anxiety can worsen incontinence by tensing muscles. Amelia tried deep breathing and meditation, which calmed her mind and reduced urgency. Even 5 minutes a day can help. Let's talk about how to stop urine leakage naturally. Avoid bladder irritants, like alcohol and artificial sweeteners. Eat fiber-rich foods to prevent constipation, which can pressure the bladder. Amelia added fruits and whole grains to her meals with excellent results. Timing your fluid intake helps. Drink most of your water earlier in the day, and taper off at night to reduce nighttime trips. Amelia also scheduled bathroom breaks every 2 hours, preventing sudden urges. Physical activity is a game changer. Gentle exercises like yoga or swimming strengthen the core and pelvic muscles. Amelia joined a senior yoga class, which improved her bladder control and mood. Medical devices like pessaries can help some women. Doctors insert these to support the bladder. Amelia's friend found relief with one, but always consult a professional first. Don't ignore warning signs. If leaks come with pain, blood, or sudden changes, see a doctor immediately. These could signal infections or other issues. Amelia caught a urinary tract infection early this way and avoided complications. Caregivers, listen up. If you're helping a loved one, be patient. Encourage open talks without judgment. Amelia's daughter helped her research solutions, making her feel supported. Products can offer peace of mind. Absorbent pads or underwear come in discreet, comfortable options. Amelia found lightweight pads that fit her lifestyle, letting her enjoy outings worry-free. Let's bust another myth. Drinking less water won't fix incontinence. It can worsen it by concentrating urine and irritating the bladder. Aim for 6 to 8 glasses of water daily, adjusted for your health needs. Sleep is affected. 2. Nighttime leaks can disrupt rest. Amelia used overnight pads and limited evening fluids, improving her sleep quality. A consistent bedtime routine also helps. Social life doesn't have to suffer. Plan outings with bathroom access in mind. Amelia mapped out restrooms during trips, giving her confidence to travel again. Small steps make significant differences. Technology can help. Apps like pelvic floor exercise trackers or bladder diaries keep you on track. Amelia used a free app to log her Kegels and fluid intake, staying motivated. Alternative therapies exist, but be cautious. Acupuncture may help some, but evidence is limited. Always check with a doctor before trying new treatments to ensure safety. Positivity is powerful. Amelia focused on small wins, like going leak-free during a movie. Celebrating progress builds confidence. You can do this too. Cost is a concern for many. Kegels, diet changes, and bladder training are free or low cost. Pads vary in price, so shop for deals. Amelia found affordable high-quality pads online. Long-term, these habits can transform your life. Amelia's daily Kegels and diet tweaks reduced her leaks by 80% in a year. She now enjoys her grandkids' soccer games without worry. Let's talk about prevention. Staying active, maintaining a healthy weight, and avoiding smoking can lower your risk. Smoking irritates the bladder, so quitting helps. Amelia's sister quit and saw fewer leaks. Community matters. Share your journey with trusted friends or family. Amelia's book club became her safe space after she opened up. You'd be surprised how many others relate. Doctors aren't just for emergencies. Regular checkups can catch issues early. Amelia's annual visits helped her doctor adjust her plan as her body changed. Let's recap the bladder control tips for seniors. Do Kegels daily. Train your bladder. Eat bladder-friendly foods. Stay active. Manage weight. Seek support. These steps are simple, safe, and effective. Amelia's story shows what's possible. She went from avoiding outings to dancing at her granddaughter's wedding. Her secret? Consistent small changes and a refusal to let shame win. You deserve to feel confident. Urinary incontinence doesn't define you. It's a challenge you can tackle with knowledge and action. Every step forward counts. If this video helped you, please give it a like. Please share it with someone who might be struggling in silence. Your support could change their life. Subscribe for more senior health tips and wellness content. We're here to empower you with practical advice every week. Drop a comment below with your questions or stories. Sharing helps others feel less alone. Let's build a community of strength and support. Thank you for watching. You're stronger than you know, and you've got this.